common thing that we will run into as gastroenterologists, and I think is probably for new users of an over-the-scope clip, new users of the PADLOCK, is a gastrocutaneous fistula from a peg tract. Patient had a gastrostomy tube, didn't need it, the tube was removed, but as we see in a certain number of cases, the tract never healed. So there was just leakage of gastric contents onto the skin. And this is an endoscopic view of that tract. This is immediate post-deployment of the PADLOCK clip, and then took the scope out, took the deployment device off, went back down, and you can see, again, a lot of tissue is pulled up, encircled, and then held in place. So this hole here was actually this area here. And so this patient did well with no leaking, further leaking on the skin. So this kind of case where you have a non-bleeding patient, there's no dangerous perforation, it's more of an inconvenience to the patient, this would be a great first case to use for over-the-scope clip for PADLOCK. You have time to look at it carefully. You could ablate this tissue if you wanted with either a heater probe or maybe some argon plasma to reduce the mucosa, and then place a clip. So I've done a fair number of these in the past, and you end up, before over-the-scope clipping, you end up placing like maybe 1, 2, 3, 4, maybe 5, through the scope clips over this. And now the PADLOCK, one clip will do the job, and it's so easy to deploy and very quick to deploy. So it can turn a long procedure into a pretty quick one.